Diazepam, a widely prescribed benzodiazepine medication, has been a staple in treating anxiety, muscle spasms, and seizures for decades. However, its use in older adults requires careful consideration due to the increased risk of adverse effects in this population. As we delve into the complexities of diazepam use among the elderly, it's crucial to understand the potential side effects, risks, and management strategies to ensure safe and effective treatment. The aging process brings about physiological changes that can alter how medications are processed and eliminated from the body. These changes often make older adults more susceptible to drug-related complications. When it comes to diazepam, the elderly may experience more pronounced and prolonged effects, which can significantly impact their daily functioning and overall well-being. In this comprehensive guide, we'll explore the various aspects of diazepam use in older adults, from common side effects to long-term consequences. We'll also discuss the importance of proper dosing, monitoring, and alternative treatment options to help healthcare providers and patients make informed decisions about benzodiazepine use in the golden years. Cognitive impairment and memory loss. One of the most concerning side effects of diazepam in elderly patients is its impact on cognitive function and memory. The drug's sedative properties can exacerbate existing cognitive decline or unmask underlying dementia, leading to significant challenges in daily life. Short-term memory disruption. Diazepam can interfere with the formation of new memories, a phenomenon known as anterograde amnesia. This effect is particularly pronounced in older adults, who may already struggle with memory issues. The drug disrupts the transfer of information from short-term to long-term memory storage, making it difficult for elderly patients to recall recent events or learn new information. Long-term cognitive effects. Prolonged use of diazepam in the elderly can lead to more persistent cognitive impairment. Studies have shown that long-term benzodiazepine users may experience difficulties with visual spatial processing, sustained attention, problem-solving abilities, information processing speed. These cognitive deficits can persist even after discontinuation of the medication, highlighting the importance of careful consideration before initiating long-term diazepam therapy in older adults. Impact on daily functioning. The cognitive impairment associated with diazepam use can have far-reaching consequences for elderly patients. Simple tasks such as managing medications, preparing meals, or engaging in social activities may become challenging. This decline in cognitive function can lead to a loss of independence and increased reliance on caregivers, significantly impacting quality of life. Strategies for mitigation. To minimize the cognitive impact of diazepam in elderly patients, healthcare providers should use the lowest effective dose for the shortest duration possible, regularly assess cognitive function using standardized tests, consider alternative treatments for anxiety or sleep disorders, implement a gradual tapering plan if discontinuation is necessary by closely monitoring cognitive function and adjusting treatment plans accordingly. Healthcare providers can help mitigate the risk of severe cognitive impairment in elderly patients taking diazepam. Increased risk of falls and fractures. The sedative effects of diazepam can significantly increase the risk of falls and fractures in elderly patients, who may already have balance and mobility issues due to age-related changes. Impaired balance and coordination. Diazepam affects the central nervous system, leading to dizziness, unsteadiness, reduced reaction time, impaired motor coordination. These effects can make it challenging for older adults to maintain their balance, especially when getting up from a seated or lying position or navigating uneven surfaces. Nighttime falls. The risk of falls is particularly high during the night when elderly patients may need to get up to use the bathroom. The combination of darkness, disorientation from sleep, and the sedative effects of diazepam can create a dangerous situation for older adults. Fracture risk. Due to age-related bone density loss, elderly patients are at a higher risk of fractures when they fall. Hip fractures, in particular, can have devastating consequences for older adults, leading to prolonged hospitalization, loss of independence, increased mortality risk. Studies have shown that long-term use of benzodiazepines like diazepam is associated with a significantly increased risk of hip fractures in the elderly population. Prevention strategies. To reduce the risk of falls and fractures in elderly patients taking diazepam, conduct regular fall risk assessments, implement home safety modifications, e.g., installing grab bars, improving lighting, encourage the use of assistive devices when necessary, consider alternative medications with a lower fall risk profile, educate patients and caregivers about fall prevention strategies. By taking a proactive approach to fall prevention, healthcare providers can help minimize the risk of serious injuries in elderly patients using diazepam. Respiratory depression and sleep apnea. Diazepam's central nervous system depressant effects can pose significant risks to elderly patients with respiratory conditions or sleep disorders. Exacerbation of existing respiratory issues. Older adults are more likely to have underlying respiratory conditions such as chronic obstructive pulmonary disease, COPD, or asthma. Diazepam can exacerbate these conditions by reducing respiratory drive, decreasing lung volume, impairing respiratory muscle function. These effects can lead to worsening of symptoms and increased risk of respiratory failure in vulnerable elderly patients. Sleep apnea complications. Elderly patients with sleep apnea are particularly susceptible to the respiratory depressant effects of diazepam. The medication can increase the frequency and duration of apneic episodes, worsen oxygen desaturation during sleep, increase daytime sleepiness and fatigue. These effects can significantly impact the quality of life and overall health of elderly patients with sleep apnea. Monitoring and management. To mitigate the respiratory risks associated with diazepam use in the elderly, conduct thorough respiratory assessments before initiating treatment. Consider sleep studies to evaluate for undiagnosed sleep apnea. Use lower doses and shorter durations of treatment when possible. Regularly monitor respiratory function and oxygen saturation levels. Educate patients and caregivers about warning signs of respiratory distress by carefully assessing and monitoring respiratory function. Healthcare providers can help ensure the safe use of diazepam in elderly patients with respiratory concerns. Paradoxical reactions and behavioral changes. While diazepam is typically prescribed for its calming effects, some elderly patients may experience paradoxical reactions, leading to unexpected behavioral changes and increased agitation. Types of paradoxical reactions. Paradoxical reactions to diazepam in the elderly can manifest as increased anxiety or panic attacks, agitation and restlessness, aggressive behavior, hallucinations or delusions, insomnia or sleep disturbances. These reactions can be particularly distressing for patients and caregivers, as they are often unexpected and contrary to the intended effects of the medication. Risk factors. Certain factors may increase the likelihood of paradoxical reactions in elderly patients. Advanced age, especially those over 80, history of psychiatric disorders, cognitive impairment or dementia, concurrent use of other medications, acute medical illnesses. Understanding these risk factors can help healthcare providers identify patients who may be more susceptible to paradoxical reactions. Management strategies. When paradoxical reactions occur in elderly patients taking diazepam, discontinue the medication or reduce the dose under medical supervision. Consider alternative treatments for anxiety or sleep disorders. Provide supportive care and reassurance to patients and caregivers. Implement behavioral interventions to manage agitation or aggression. Consult with a geriatric psychiatrist for complex cases. By promptly recognizing and addressing paradoxical reactions, healthcare providers can minimize distress and ensure appropriate treatment for elderly patients. Drug interactions and polypharmacy concerns. Elderly patients often take multiple medications, increasing the risk of drug interactions and adverse effects when diazepam is added to their regimen. Common drug interactions. Diazepam can interact with various medications commonly prescribed to older adults, including opioid pain medications, antidepressants, antihistamines, antipsychotics, certain antifungal medications. These interactions can lead to increased sedation, respiratory depression, and other adverse effects. Polypharmacy risks. Polypharmacy, the use of multiple medications, is common in the elderly population and can complicate diazepam therapy by increasing the risk of drug-drug interactions, enhancing the sedative effects of diazepam, complicating medication management and adherence, masking symptoms of adverse drug reactions. Healthcare providers must carefully consider the entire medication regimen when prescribing diazepam to elderly patients. Strategies for safe medication management. To minimize risks associated with drug interactions and polypharmacy, conduct comprehensive medication reviews. Regularly use electronic prescribing systems with built-in drug interaction alerts. Consider alternative treatments with lower interaction potential. Educate patients and caregivers about potential drug interactions. Encourage the use of a single pharmacy to fill all prescriptions by taking a proactive approach to medication management. Healthcare providers can help ensure the safe and effective use of diazepam in elderly patients with complex medication regimens. Withdrawal symptoms and dependence. Long-term use of diazepam can lead to physical dependence and challenging withdrawal symptoms, particularly in elderly patients. Recognizing dependence. Signs of diazepam dependence in older adults may include increased tolerance to the medication's effects, anxiety or agitation when doses are missed, preoccupation with obtaining and using the medication, continued use despite adverse effects or lack of therapeutic benefit. Healthcare providers should be vigilant for these signs, as dependence can develop even with prescribed doses. Withdrawal syndrome. Abrupt discontinuation of diazepam can lead to a withdrawal syndrome characterized by rebound anxiety or panic attacks, insomnia and sleep disturbances, tremors and muscle twitching, nausea and gastrointestinal distress, sensory hypersensitivity in severe cases, seizures or delirium. Elderly patients may be particularly susceptible to severe withdrawal symptoms due to age-related changes in drug metabolism and elimination. Tapering strategies to minimize withdrawal symptoms and ensure patient safety. Implement a gradual tapering schedule over several weeks or months. Monitor patients closely for signs of withdrawal or rebound symptoms. Provide supportive care and reassurance throughout the tapering process. Consider adjunctive treatments to manage specific withdrawal symptoms. Collaborate with addiction specialists for complex cases by carefully managing the discontinuation process. Healthcare providers can help elderly patients safely transition off diazepam while minimizing discomfort and risks. Alternatives and non-pharmacological approaches. Given the potential risks associated with diazepam use in the elderly, exploring alternative treatments and non-pharmacological approaches is crucial. Alternative medications for anxiety and sleep disorders. Healthcare providers may consider selective serotonin reuptake inhibitors, SSRIs, buspirone, gabapentin, melatonin, or Ramelteon for sleep disturbances. These alternatives may offer similar benefits with potentially lower risks for elderly patients. Cognitive behavioral therapy, CBT. CBT has shown effectiveness in treating anxiety and insomnia in older adults. This approach can help patients identify and challenge negative thought patterns, develop coping strategies for managing anxiety, improve sleep hygiene and habits. CBT may be particularly beneficial for elderly patients as it avoids the risks associated with medication use. Mindfulness and relaxation techniques. Teaching elderly patients mindfulness and relaxation techniques can provide valuable tools for managing anxiety and promoting better sleep. These may include deep breathing exercises, progressive muscle relaxation, guided imagery, meditation practices. These techniques can be easily incorporated into daily routines and may offer long-term benefits without the risks of medication use. Lifestyle modifications. Encouraging healthy lifestyle changes can significantly impact anxiety and sleep quality in elderly patients. Regular physical activity appropriate for the individual's abilities, maintaining a consistent sleep schedule, limiting caffeine and alcohol intake, engaging in social activities and hobbies, creating a relaxing bedtime routine. By implementing these non-pharmacological approaches, healthcare providers can help elderly patients manage their symptoms while minimizing reliance on medications like diazepam. Monitoring and follow-up care. Regular monitoring and follow-up care are essential for ensuring the safe and effective use of diazepam in elderly patients. Frequency of assessments. Healthcare providers should establish a schedule for regular assessments, which may include monthly check-ins during the initial treatment period, quarterly assessments for stable patients on long-term therapy, more frequent evaluations for patients with complex medical histories or multiple medications. These assessments allow for timely identification and management of any emerging side effects or complications. Comprehensive evaluations. During follow-up visits, healthcare providers should conduct comprehensive evaluations that include assessment of medication efficacy and ongoing need for treatment, screening for adverse effects and drug interactions, cognitive and functional assessments, fall risk evaluations, review of sleep quality and patterns, assessment of overall quality of life and well-being. These evaluations provide a holistic view of the patient's response to diazepam therapy and inform decisions about ongoing treatment. Laboratory monitoring. Periodic laboratory testing may be necessary to monitor for potential complications of long-term diazepam use in elderly patients. This may include liver function tests, complete blood count, renal function tests, vitamin D and calcium levels. For patients at risk of osteoporosis, regular laboratory monitoring can help detect early signs of organ dysfunction or other adverse effects. Collaboration with specialists. For complex cases or patients with multiple comorbidities, collaboration with specialists can enhance the quality of care. This may involve geriatric psychiatrists for management of behavioral symptoms, neurologists for patients with cognitive impairment or seizure disorders, sleep specialists for management of sleep apnea or other sleep disorders, pharmacists for medication reviews and optimization. By taking a collaborative approach, healthcare providers can ensure comprehensive care for elderly patients using diazepam. Patient and caregiver education. Educating patients and caregivers about the proper use, potential risks, and warning signs associated with diazepam therapy is crucial for ensuring safe and effective treatment. Medication administration. Provide clear instructions on proper dosing and timing of medication, what to do if a dose is missed, importance of not abruptly stopping the medication, potential interactions with other medications or substances, encourage the use of pill organizers or reminder systems to promote adherence and prevent dosing errors. Recognizing side effects, educate patients and caregivers about common side effects and when to seek medical attention. This may include excessive drowsiness or confusion, unsteadiness or increased fall risk, changes in mood or behavior, difficulty breathing or shortness of breath, signs of allergic reactions. Provide written materials or checklists to help patients and caregivers monitor for these effects. Safe storage and disposal, discuss the importance of keeping medications in a secure location using child-resistant containers, proper disposal of unused or expired medications, not sharing medications with others. These practices help prevent accidental ingestion or misuse of diazepam. Lifestyle considerations, advise patients and caregivers on avoiding alcohol consumption while taking diazepam, refraining from driving or operating machinery if experiencing drowsiness, implementing fall prevention strategies in the home, maintaining a consistent sleep schedule and practicing good sleep hygiene. By providing comprehensive education, healthcare providers empower patients and caregivers to actively participate in safe medication management. Conclusion: the use of diazepam in elderly patients requires careful consideration of the potential benefits and risks. While it can be an effective treatment for anxiety, muscle spasms, and seizures, the increased susceptibility of older adults to adverse effects necessitates a cautious approach. Healthcare providers must weigh the therapeutic benefits against the potential for cognitive impairment, increased fall risk, respiratory depression, and other complications. Regular monitoring, appropriate dosing, and consideration of alternative treatments are essential components of safe diazepam use in the elderly population. By implementing comprehensive care strategies, including patient and caregiver education, non-pharmacological approaches, and collaborative care with specialists, healthcare providers can help ensure the best possible outcomes for elderly patients requiring benzodiazepine therapy. Ultimately, the goal is to provide effective symptom management while minimizing risks and maintaining the highest possible quality of life for older adults. As our understanding of geriatric pharmacology continues to evolve, ongoing research and clinical vigilance will be crucial in optimizing the use of medications like diazepam in the elderly population.